Welcome, everyone. We're here today to talk about a topic of great interest to so many people, anxiety, and perhaps how cannabis can help anxiety. And I'm joined here with Patricia Frye, Dr. Patricia Frye, who's our Chief Medical Officer at HelloMD. And Dr. Frye, could you just tell everyone a little bit about yourself and how you ended up here talking about anxiety and cannabis?
Well, I am a cannabis clinician, and I started my career in treating patients with cannabis at HelloMD back in the early days.
First doctor. This is our first doctor. Yep, the very early days.
The very early days, and I have continued to find cannabis to be a wonderful medication to treat a lot of conditions that have not responded well to conventional pharmaceuticals. Mm-hmm. I wrote a book, and
what was the name of the book?
The name of the book is The Medical Marijuana Guide, Cannabis and Your Health.
And it's a fantastic book based on the thousands of patients you've now seen, and you are one of the leading cannabis clinicians in the nation, if not the world, I would say.
And a lot of those patients I saw in my days with HelloMD, yes.
So, I'd love to get right into it and talking about anxiety and cannabis. As you know, and probably everyone in this audience knows, anxiety is a really big issue in our society today. And so why don't we start with a general question, which is, what exactly is an anxiety disorder?
Well, anxiety and anxiety disorder are two different things. Mm-hmm. We all have anxiety at some point, and it can be very helpful. It helps us prepare for presentations or get ready for things. A little bit of anxiety helps us work a little harder to get to a given goal. Mm-hmm. But when anxiety is excessive and persistent and there's worrying and you can't control it, it can cause significant distress and impairment, and that's what we call general anxiety disorder. And that type of anxiety occurs most days for at least about 6 months.
Yeah, and that's no fun. I mean, when you have an anxiety disorder, that interrupts your entire life, does it not?
It's very disruptive, yes.
And have you found cannabis to be helpful?
I have. I would say that anxiety is one of the conditions that I treat most. It is there are varying degrees to anxiety. I'll have to say I don't see as many patients with the full-blown general anxiety disorder, although I do see it. But mostly there's job-related stress that causes anxiety. Some patients have presentation anxiety. They're fine except if they have to get in front of a camera or in front of a large
like
group.
This.
Yeah, like this.
Like the large group.
Yes.
Lights, camera, action. It's
yes.
a little... Can make you a little anxious.
They can make you anxious and freeze up. There are people who have social anxiety where they are overly concerned that they're going to make a mistake or be judged by what they say or do. And then we have anxiety associated with PTSD, patients that are phobic, that have anxiety or fears about specific situations or objects like snakes or airplanes, flying anxiety. And then we have panic attacks, which is a more intense physiological reaction to anxiety.
So what are the potential long-term health consequences of having anxiety disorder or just anxiety in general if it goes unchecked?
The only long-term health issues that I'm aware of is that there seems to be an association with anxiety and cardiovascular disease. But other than that, I'm not aware of any long-term effects, except that it can be impairing. It can definitely affect a person's quality of life.
Well, I know I suffered from anxiety for quite some time, and it seems to be a cyclical thing. You think anxiety is going to come, so then you get anxious about having the anxiety, and I would find that I wouldn't be able to sleep, and my stress levels were so high. Mm-hmm. So, I know that cannabis eventually ended up helping me, specifically CBD, but we'll get into that in a little bit. I just want to remind everyone that you can ask your questions about cannabis and anxiety in the chat, and one of our knowledgeable HelloMD doctors will answer your question. Okay, so I'm going to give you a did you know fact. Are you ready for it?
I'm ready.
Okay. Did you know that anxiety can be physically painful?
I did know that.
So the fight or flight response creates tightness in the chest, headaches, nausea, and muscle tension. So what do you have to say about that?
severe anxiety, especially with panic attacks, it's not uncommon for people to have difficulty breathing, to have an increased heart rate, and to experience chest pain. Mm-hmm. And it often takes them to the emergency room with the concern that they're having a heart attack. It is also associated with, of course, nausea. Anxiety can be so great that it can cause vomiting and diarrhea.
That is no fun. I'm going to give you a fun fact that I once had an anxiety attack in a job interview, and I actually got sick. And I got the job, which is even more surprising.
That is.
Yeah, it is pretty surprising. Okay, our next question. So how can cannabis help people with anxiety? What exactly is the mechanism that helps to stop the anxiety?
Well, everyone has this endocannabinoid system, and this is like a nervous system within our nervous system, and it modulates a lot of neurotransmitters in the brain, including serotonin, glutamate, GABA, a number of different neurotransmitters. There's an area of the brain called the amygdala, and that's where a lot of our emotions originate, where our anxiety resides. And the compounds in the cannabis plant, like CBD and THC, can modulate how that endocannabinoid system protects us against excessive anxiety. And it also can help with other emotional issues, because we often have things like depression and obsessive compulsive disorder that go along with anxiety disorder. The cannabis compound THC can interact directly with the receptors in the endocannabinoid system. CBD actually works indirectly by interfering with the breakdown of one of the cannabinoids our bodies make, and it's called anandamide. We have another one called 2-AG, but anandamide can help, and THC can help to control that serotonin activity in that area of the brain.
So does it, if you simplify all of that, does it just basically help to relax us?
Well, it's not only is it a muscle relaxant, so we do relax, but it kind of turns down the circuitry in that area so that our brain can kind of calm down. And it can be very effective. Now, you have to be careful with THC, because small amounts can be very helpful in treating anxiety, but too much THC can actually cause anxiety or make the anxiety you have a lot worse.
And we've all heard that story of somebody getting a paranoid or anxious attack after having too much THC, especially with the intensity of some of the edibles out there. People don't know how much they're ingesting.
That's true.
Yeah.
And even with the flower, it is difficult to find flower under 15% or so THC. So my advice for patients who have anxiety is to stay with a CBD or a CBD dominant tincture or inhaler if you're having a panic attack.
That is great advice. Okay, so just another reminder to our audience, if you have questions about cannabis and anxiety, please ask them in the chat, and one of our knowledgeable HelloMD doctors will answer your question. Okay, so we are going to move on to the next question. Are you ready?
I am ready.
You are always ready. That is one thing that Dr. Frye is always ready. Okay, is there any research that suggests that CBD can help with anxiety?
There's a lot of research. That is one of the areas where there are probably close to 30 or 40 studies, both animal studies and studies on brain activity in humans, that categorically show that cannabis is what we call anxiolytic, which is the medical term for stopping anxiety.
And would you say that they are more effective, in your opinion, or perhaps the research shows this, than the traditional anti-anxiety medications and pharmaceuticals on the market today?
Well, everyone responds to cannabis differently, just like people respond to pharmaceuticals differently. There's some people who do beautifully with pharmaceuticals. There's others that suffer a lot of the adverse effects. When those aren't working, or if someone chooses to use cannabis, it's best to start it and see how it helps. But it can absolutely treat anxiety in most patients without the adverse effects that we commonly encounter with pharmaceuticals.
I know in my own experience, because I did start taking CBD for my migraines, and it eventually helped solve that problem, but one of the fallouts of having chronic pain was that constant anxiety, and I was really surprised by how quickly the anxiety was kept at bay with just the CBD.
And that's a common scenario, that chronic pain often causes people to be anxious or depressed, or both. And both of those emotions, anxiety and depression, actually signal the release of pro-inflammatory mediators that cause pain or increase pain. So for chronic pain patients, it's very important to treat any anxiety that they might be experiencing.
I like that answer. So, are you ready for a Did You Know fact?
I'm ready, Pamela.
I think you're more than ready. You're like way ahead. Okay, anxiety is more prevalent in developed countries and among women, and the U.S. is considered one of the most anxious nations in the world. Did you know that?
I did know that.
I knew you'd know that. But it is an interesting fact, and I'm always wondering, why is it that the United States has so many anxious people? What's going on?
Well, I think a lot of it has to do with lifestyle in the U.S. and I'm convinced that our diet may have a contributing factor. We have so much omega-6 in our diet. We have processed foods, fast foods. We don't eat enough vegetables. Even the food that we eat, like meat, it comes from feedlot animals that are highly stressed and full of stress hormone. And all of these things contribute to inflammation. And there is data to implicate inflammation as part of the underlying, what we call pathophysiology, which is just a long word that means what causes a problem. That inflammation can actually be part of the pathophysiology of things like anxiety and depression, as well as chronic pain.
So it sounds like an anti-inflammatory diet is at the top of the list of prevention for anxiety, but what do you think about just the daily routines that we have here in the United States with screen time and the go, go, go mentality? Do you think that that is an underlying structure to what creates so much anxiety?
It certainly can be. We don't have the downtime and relaxation time that we once had. Even time for relaxation that's used playing, let's say, video games, we're constantly stimulated. We really don't take the time to just take a breath and exhale and just be.
Yeah. And there's also, aren't there studies that show just taking a walk in nature really sort of calms the body, mind, and spirit and just centers us?
Absolutely, and exercise is a key component to successfully treating anxiety. I encourage all patients to implement an exercise program that involves at least 30 minutes and preferably an hour a day of vigorous exercise. It can be the best treatment for anxiety.
You are a taskmaster.
I am.
So, as with so many things, cannabis is not necessarily a silver bullet. It's sort of one of those tools that you have in your wellness toolkit, but you have to combine it with just basic sort of common sense, I guess, is what you're saying.
I really see a lot of improvement with using cannabis, usually CBD, sometimes with a small amount of THC. But when you combine that with exercise and a healthy, non-inflammatory diet, you can see some pretty impressive improvement.
That's great. Well, it's good to hear. And we have a question that has been asked online. And the question is this. I struggle with anxiety, and CBD often doesn't turn my brain off, or at least slow it down enough. THC can help, but if I even have a little too much, I become seriously anxious. What do you suggest?
First of all, I would question the dosage of the CBD because CBD is probably one of the best medicines for anxiety. So if you start it with a small amount, gradually increase it. I advise increasing the dose maybe every 5 to 7 days. You have to give it some time. I also recommend dosing twice a day.
And does it build up in the system as well, CBD?
It doesn't really build up, but it can take a while for you to really see the changes in the neurotransmitters.
Got it.
So I have patients increase the dose gradually every 5 to 7 days, And if it's not helping, then adding a small amount of THC can increase its efficacy because those cannabinoids work better together than by themselves. THC can be an overshoot. You have to be very, very careful with the dosing. If you're going to use THC for anxiety, I strongly recommend microdosing, and that is talking about maybe even less than a milligram, certainly no more than 5 milligrams of THC, and that might be too much.
Okay, so how is the endocannabinoid system involved in our stress response?
Well, stress is different from anxiety, okay? And CBD in particular can interrupt the stress response that starts in our brain in an area called the hypothalamus. So when we are faced with a life-threatening
Bear.
Yeah, a bear.
When a bear is chasing you.
When the bear's in the room, it's looking at you.
Or a cheetah.
Yes.
Is it a cheetah?
A cheetah
I think
would
it's a
be
cheetah.
stressful as well.
A cheetah would be stressful. You don't want to
Yes.
find yourself in a room with a cheetah.
No.
Unless it's me.
No, I don't. Or a cougar.
Yeah. Go on.
Okay. So the bear or the cougar's in the room.
It is.
So your brain says, oh, I have to be able to run very fast.
Yeah. Go on.
So it sends a message down to the pituitary gland that sends a message down to the adrenal glands, which
Right.
sit on top of your kidneys. And it causes those glands to release hormones into your system that divert blood away from your GI tract. No sense in thinking about a snack at the moment. And it sends all the blood to your arms and legs and helps you run as fast as you can.
The fight or flight response.
The fight or flight, yes.
You better run from that cougar.
That's right. Or at least run faster than the other person in the room.
Right.
Yes.
Okay.
So that's the stress response. And CBD actually gets in there and turns that off. And it
Okay.
works beautifully for stress. And stress, I have to point out, is different from anxiety. Stress can be productive. Stress is needed to survive if you're in a life-threatening situation. But anxiety is impairing.
Ongoing.
It's ongoing and it's impairing.
Okay, that's a fantastic answer and fairly clarifying because, you want to know that you can actually run faster than the cougar.
Or the other person in the room.
Yes. So, next question. What dosing would you typically recommend for someone who wants to take CBD for anxiety?
Actually, I recommend it the same way I recommend CBD for almost anything. You start with a small amount, and that could be by the drop or by the milligram. I'm not that concerned about the milligrams, so whatever concentration of that CBD is, you just start with a small amount. And I do recommend tincture because it's very easy to titrate or to figure out how much you need. And so I have patients start with a drop or two or 3 drops. I like for them to put it under their tongue. They hold it for a minute or so and then swallow. And they dose twice a day. In 5 to 7 days, if they're not feeling better, they increase it by a dose or 2. And you do that every 5 to 7 days. So figuring out the dose that's effective for you, the individual, is a process. And it doesn't happen overnight. And it takes a little bit of patience. But eventually, patients notice that the things that they have found to be upsetting or anxiety provoking in the past just aren't. And they don't get that druggy, kind of sedated feeling that you can get from some of the other medications that we use to treat anxiety. So it's a gradual process. If they have panic attacks, you don't want to wait and figure out how much you need. And that's one of the few instances where I really find vaping to be beneficial. So in a panic attack, I advise patients to vape a CBD dominant product and take 1 puff, maybe 2, and wait 10 minutes. In 10 minutes, if your heart is still racing, you're still dizzy, you're still in a panicky mode, then take another puff. And I have treated patients even in my office who have been in the middle of a panic attack, and it usually only takes 3 or 4 puffs before they're feeling better.
That's great information to know, because when you're in the middle of a panic attack or you feel one coming on, it's really important to take a step back and to be able to stop it if you can.
Yes.
All right, are you ready for a Did You Know fact?
I'm ready.
Okay, I have a feeling you might know this one.
Okay.
Okay, so did you know that routines can help with decreasing anxiety? And if people tend to know what's coming up in their day, they're able to decrease their anxiety because there's not so much unknown.
That's true, but days typically are unpredictable.
I was about to say that. I don't know about your day, but my day is a little bit crazy. I never know what's going to be coming at me. So,
And the other response I would have to that fact is that you have to be careful, because sometimes anxiety is the force behind obsessive compulsive disorder. So sometimes we don't want to be too routine oriented or ritualistic, because that can be a whole nother set of problems.
that's interesting. And it actually ties into the next online question we've received, which is, can cannabis help me with my OCD? And so maybe you could talk a little bit about what OCD is and how you've seen cannabis to help that, if at all.
Well, OCD is, it stands for Obsessive Compulsive Disorder. And it generally is anxiety driven, and people will develop ritualistic or repetitive behaviors that they're just not helpful, and they can interfere with their daily lives. They can recheck to make sure they turned off the light. They can go back to their house like 5, 10, 15 times to double check to make sure they turn the light off. It can be excessive hand washing. There are a number of symptoms that are associated with OCD, but because there does seem to be an element of anxiety behind that, again, cannabis can be helpful. And I have treated patients with OCD. They usually have anxiety and other issues. And we can see that too in autism. And there are a lot of repetitive behaviors that interfere with daily functioning. And oftentimes we can see a decrease in those repetitive behaviors by using CBD.
Okay, a very common question we receive is, does cannabis interact with medications like benzodiazepines or SSRIs?
Well, CBD utilizes an enzyme that's used to metabolize benzodiazepines. And this can be a problem with daytime dosing if they're taken in close proximity. If the CBD interferes with the benzodiazepine, you'll get a higher plasma level than anticipated, and it could cause sedation, it could cause a little confusion, and these are mainly problems for patients that are at risk of falling. So if patients are on a benzodiazepine and they're taking CBD, they should space it at least 2 to 3 hours or take their benzodiazepine at bedtime. SSRIs are not commonly a problem. There are different SSRIs, and it would be difficult to go through each one in this format.
Can you give an example of an SSRI?
Sertraline or Zoloft.
Okay.
And there doesn't appear to be any interaction. I have a lot of patients who are on things like sertraline or Paxil, Lexapro. These are all medications that were initially used to treat depression, but we also found that they do help with anxiety. Zoloft in particular is often prescribed for anxiety.
So let me ask you this. Do you find that when cannabis is introduced to a patient who's either on a benzodiazepine or an SSRI, that they're able to either taper down the dosage that they're taking or get off of those medications altogether with cannabis?
Yes, I do see that. Not everyone likes to take SSRIs. As you might know, that SSRIs are commonly the culprit behind decreased libido or sexual desire, and that can be problematic for a lot of patients. So they're often very happy to taper off and wean off their SSRIs and benzos.
All right, so an online question that we've received is, what kind of cannabis can help me with my panic attacks?
Everyone has a different endocannabinoid system. Everyone responds to cannabis differently. So I can't say specifically what variety of cannabis would help, but I would say that a CBD dominant variety is where to start. And for anxiety, I would start around a 10-to-1, meaning that for every 10 milligrams of CBD, there might be 1 milligram of THC, or even a 20-to-1. The THC is not as important for anxiety alone, but when patients have anxiety and depression, it is important to have a little bit of THC on board. At those ratios, a patient is not going to feel intoxicated or impaired or have any type of high or stoned feeling. They'll just feel better. They start with a small amount and they gradually increase it. And if it doesn't help, they can try a different delivery system like inhalation. But tinctures are best for mental health issues because they last in the system so much longer. When you dose in the morning, that dose will last 5 to 8 hours.
That's good to know. I just want to remind everyone in the audience that if you have a question about cannabis and anxiety, please feel free to ask that question in the chat, and one of our knowledgeable HelloMD doctors will answer your question. All right, so we're going to move on to our last question about cannabis and anxiety for the day. Would it be a good idea to take CBD every day as a preventative for anxiety reduction?
I think if a patient is having problems with anxiety, they should dose at least once and maybe twice a day, and I recommend that patients continue that for 2 to 3 months. Generally, in that amount of time, the anxiety issue is much improved, and then they can crank it down to maybe 3 or 4 times a week. And then some patients don't need to take it again unless they are anticipating an anxiety-provoking situation like public speaking or...
Yeah, tell us about public speaking. Is it still the number one fear of people? Yeah, I mean, you must see people all the time. Does it really rattles people?
It does. Public speaking and flying and bridges. Crossing bridges
I was thinking like the bridge, the game. I was like, why? Bridge does not seem anxiety-provoking. Crossing bridges.
Have so much anxiety crossing bridges that they have to get someone else to drive. But using CBD in advance can often help them, get through that.
Well, Dr. Frye, thank you so much. I feel like I learned so much today about anxiety and cannabis. We hope that you did as well. So today it's a wrap, and we look forward to seeing you next week for our next episode of Ask a Doctor.